So what we are here to talk about today is treatment of cancer in the modern era. I'm going to focus a little bit more on lung cancer today because if I get into all of cancer, this will take days to get done with. So we have a 65-year-old female with a past medical history of coronary artery disease, diabetes, hypertension, who's a 1 pack per day smoker for the last 50 years, who presents to a new primary care provider's office for a routine checkup. She has no complaints and is doing well on current management. She has no family history of cancer. So what do we do? For someone who has no complaints, no family history, if you go to your primary care doctor's office, what does a PCP do? They want to make sure your risks of cancer are low. A primary care doctor will be thinking, okay, this patient's come to my office, does she have a colon cancer risk? The new guidelines for colon cancer screening state that everyone should be screened starting at age 45. This used to be 50, but this year it changed, and they should get colonoscopies every 10 years. Patients that are at high risk for colon cancer, they should be screened sooner and more frequently. So if you have a family history, if you have a genetic mutation that predisposes you to colon cancer, the screening has to be more frequent. Now the other thing is mammograms. So the primary doctor is thinking, what about mammograms for this patient? The USPSTF, United States Preventative Services Task Force, recommends mammograms starting at 50, but they do leave that option open to have mammograms at 40 for some people. So recommendations are to start mammograms at 50, then after that you do mammograms every 2 years. High-risk patients, once again, if you've had radiation exposure, if you have family history of breast cancer, if you have a genetic mutation, those things change the screening recommendations. And those have to be individualized per the patients. And sometimes in young high-risk patients, we even do breast MRIs for screening. The newest kid on the screening block is lung cancer screening. So this also has changed this year. It used to be 30 pack years or 35 pack years, age 55 or above. This year they changed it to 20 pack year smoker, age 50 to 80, who smoke currently or have smoked in the last 15 years. If you've quit longer than 15 years ago, the USPSTF does not recommend lung cancer screening in that population.